name is Justina Ritchie and I'm the Service Manager for Community Mental Health Nursing across Dumfries and Galloway. What we've been doing over the last 18 months is we've had a pilot running within 2 practices in Stewartry and 2 practices in Wigtonshire, where we've had community mental health nurses based in the primary care centres working alongside the GPs. So providing early assessment and interventions to people with mild to moderate mental health issues. Because the pilot's been so successful and we've had really good outcomes for patients and good feedback from the GPs, that it's saving them time and people are being seen quicker and dealt with through specialist services, the plan now is to roll that out across the region. So we've recently recruited to 5 posts across Annandale and Eskdale and Dumfries and Galloway, Dumfries and Nithsdale, and we're currently in the process of recruiting 5 posts for Wigtonshire and Stewartry localities. We're planning to cover every GP practice across Dumfries and Galloway. With the people coming into post in Dumfries and Nithsdale and Annandale and Eskdale, they'll be due to start mid-January. The posts for Stewartry and Wigtonshire, we've already got the 2 pilot posts in there at the moment, but the rest will be in place hopefully by the end of February, beginning of March. And our plan is to have at least 1 session for every GP practice across Dumfries and Galloway. I think the benefit to patients is we've recognised for a long time that there's been a gap between the people who come to the community mental health nursing team, who are your more kind of severe and complex people, to people that the GPs have been managing with mild to moderate mental health symptoms. The issue with that is that the GPs don't have as much time or resource to see people or spend time with people and provide interventions. So hopefully the people that will be seen through primary care mental health will get quicker access to mental health specialists and get access to interventions that will help them self-manage their mental health difficulties. So they probably won't need to move on to the kind of secondary services. Our aim would be eventually to have a mental health team sitting within primary care. So there would be mental health nurses, occupational therapists and psychology sitting within primary care, with the aim that if people come in to primary care with mental health problems, the mental health team will look at that and decide who's the best person to see that person. The new GP contract, we've recognised the need to support GPs to provide services within those primary care practices, to allow the GPs to release time to carry out that kind of more generalist role. Initial response is very positive both from the patients and from the GPs who've been involved in that pilot. As I say, it's freeing up GP time. People are being seen quickly, interventions, short-term interventions put in place to enable them to self-manage, and the outcomes for them have been really positive.